A very good morning and welcome to the Breakfast Club on Asake Online. My name is Sizwakele Ndlovu. On the show today, I'm speaking to the CEO of Sila Health, and he is Mr. Babusi Nyoni, and is not just the CEO of Sila Health, he is also a creative technologist, an AI design strategist, an entrepreneur, and an innovator. So one of his key focuses is, I quote, finding digital solutions for sub-Saharan communities. Mr. Nyoni, welcome to the Breakfast Club.
Thank you for having me.
Should I call you Mr. Nyoni or Babusi?
Babusi is fine.
Okay. So Babusi, this is a very interesting description of who you are. But before we get into that, who were you before you had all these titles? And where did you grow up? A brief history of who you are.
So I grew up around Bulawayo, mostly around the southern suburbs. So Montrose, Morningside, all these places. The highest level of education for me was Founders High School. And post working there, I worked in security. I worked in an internet cafe. I used to paint houses. I was an electrician for like a short period. I was printing photos. I did a lot of things leading up to what would become a career in graphic design, which then morphed into user interface design, which then turned into development and a lot of things after.
Okay, painting.
A lot of things, yeah.
Okay, and how then did you get into this field that you're currently in?
So I think if I were to put myself in a box, I would say I'm a problem solver, but I use technology to do that. And I think leading with design as a career choice for me, there's this quote by Kanye West that is, art is to be free, but design is to solve. I've been using design thinking to solve problems and equipping myself with skills like coding along the way to ensure that I can create things that, solve the problems that I intend to solve, and also at the fidelity that I can definitely guarantee. And I picked up development in 2013 and worked on my first machine learning or artificial intelligence project in 2016. And yeah, I mean, I'm sure we'll have a lot of time to talk about these projects, but that's been more or less the journey.
Okay. So when we say artificial intelligence, for the benefit of somebody who might not be fully aware, what can you say that is in a nutshell?
So artificial intelligence is the theory and development of computer systems performing tasks that are typically performed by human beings. So this can be things like visual perception through computer vision, or natural language processing, which is the part of machine learning that basically deals with the way computers understand the way humans speak and understand speech as well. And it's something that has evolved over time with the spike in prevalence as well as technology most recently. So initially, you'd only be able to run a machine learning model on a very high level computer, but now you can run machine learning on phones and everything. And yeah, there's different ways to call it. So I usually call it artificial intelligence because that's what a lot of people are familiar with. But to be, a stickler for nuance, it's actually machine learning.
Okay, so this is the process of getting machines to become like us and eventually replace us.
Hopefully, yeah.
Why? You sound excited.
You say replace us. If I can get into your brain, probably thinking about jobs, right? But I think that'll free us up to do more meaningful things. Right now machines are already replacing humans that were performing really repetitive tasks to do things that, engage the brain in a way that makes the best use of our amazing ability as human beings. So I'm looking forward to not having to, do my taxes and do all these things and have a robot that's dedicated to that. Even like housekeeping and all these things. Do you really want to clean your house that badly? Yeah, exactly.
I saw a debate, and I'm not well versed in this industry of yours, but I picked up something along the lines of these machines are learning at a much faster rate than we thought possible, and they might actually be outthinking us. We're looking forward to a robot revolution. You watch all these movies, robots turning against people, enslaving them. What is the reality on the ground?
So reality on the ground is that, yes, artificial intelligence as I'd say like a technology has been growing in leaps and bounds in recent years, more than, previously. And it is getting to a point where machines are now performing better than human beings at certain calculations and things, but if you and I know anything about what it means to be smart versus to be, educated, at least from that fundamental level, there is a massive gap between what machines can do and what we can do. And there's an event called the Singularity event, which is a moment at which machines will surpass human intelligence. And that will probably happen within the next 10 to 20 years. But then the idea of machine sentience is one that will probably happen much later than that. So sentience being a machine being aware that it exists and wanting to make that existence felt. Don't freak out, the viewers at home.
Is it a robot called Sophia?
Yeah.
Who said that she wants to have a baby? She wants to have a family. And I'm like...
Yeah, I mean, yeah. So Sophia is more or less like an educational thing that's trained on natural language processing. So it's not sentient at all. It's trained on conversations. So what it says to you is, this is maybe a good segue to one of the projects that we have, which is this chatbot called SysChoice, which actually speaks like a person, but it's not sentient at all. It just speaks out of conversations that have been recorded between actual people, and it's just speaking like a human, but it's not actually human.
What if the robot is tricking us into making it think that we're having a conversation and it's what it could be? What? Sentient?
Sentient. No, we're still a long way from that, which would be also a nice reality. I'd love to see what the rights landscape looks like for software and people, but we're still a long way from that.
Let's come back to the core business while we're here.
Let's do that.
Sila Health.
Yeah.
Tell us about the organization, when it started and what you offer.
So Sila Health was started by 3 Zimbabweans living in the diaspora in the Netherlands, Germany, and South Africa specifically. And it was started with the mission to increase access to healthcare for people who can't afford basic care, and also for people for whom, Googling symptoms and trying to, handle that triage yourself would be too expensive because of the cost of the internet and all these other things. And it started as a simple chatbot that was powered by a spreadsheet with simple answers to questions. And then we realized in doing this initial pilot that people wanted to speak in a natural way. They didn't want to select yes, no for things related to their personal health, because personal health is personal. So we trained a machine learning model to understand the way people report their symptoms in the African context, which is important because a lot of similar solutions that are built in the global north, will speak about symptoms in a way that caters to mostly white people. So, for example, being short of breath, being stated as presenting purple or blue lips, which for a black person it's like, am I really, or should I wait until my lips turn blue or something? So we built it to also understand the way that we report symptoms. Let's say within a Zimbabwean context, you wouldn't say I have a stomach ache, you'd say my stomach is sore in a vernacular language. So we trained it from the ground up to understand the way young Africans speak about symptoms, and also reporting back to them on probable diseases and steps to take in a very simple way, which would cater for people with varying levels of literacy. And we started in Zimbabwe. To date, we're active in over 50 countries, including Kenya, Nigeria, Ghana, even as far afield as the US. And over 1 million messages have been exchanged on that platform. And it's won awards from entities such as the Africa Union, UNDP, Dutch organizations like Pathos. It's been showcased in so many places around the world as well.
Okay, so the aim is to be able to get a diagnosis via social media. Exactly. And then what happens then after that?
Yeah, so we initially started, of course, as 3 young Africans with limited budget spend on growing a technical solution. We started just by simply providing this autonomous solution, but then we slowly started building out a partner network to allow people who need to see a doctor to be able to do so. So we would, in places like Kenya, we have partners like Access Afya, who we refer patients to directly. We have partners in Nigeria as well. And then in Bulawayo, we have a network of our own doctors that we spent a couple of months sourcing. And we're also, as mentioned offline, about to open a surgery which would allow people who use our platforms to go and see a GP and also have procedures done.
Okay, so from what I'm understanding, people Google their symptoms virtually and then get referred to a doctor virtually and then get a diagnosis virtually and then they go to a pharmacist.
Yeah. Okay, so first they wouldn't Google because for a lot of people, especially the people that we serve, accessing the internet for them is accessing WhatsApp and Facebook Messenger maybe, right? So they would chat directly with this chatbot that already has their patient history and everything and knows their pre-existing conditions. And based on the severity of the symptoms they've reported and also the triage disease, we make a recommendation for either emergency care or just a doctor consultation. We have built for purpose tools for virtual consultations as well, ones that don't require any apps, that work simply in a browser and also store a patient's conversation as part of their health records. And if needed, a patient can be seen physically, but oftentimes we're able to have virtual consultations and create e-prescriptions and send these to our pharmacy network in Zimbabwe and also have these delivered for free.
Wow, so when did the Bulawayo setup start and what's been the response like so far?
Yeah, so it's been pretty good. So I've been speaking, I think the past 2 questions about a product that we have called Healthpass, which basically allows Zimbabweans living in the diaspora to pay for care directly back home. And what we discovered in doing our research before launching this product is that for a lot of people living abroad, when they send money home for, say, a doctor consultation or dentist appointment, I love my people, but people would take that money, and either go to like a public facility or not actually, have the procedure done at all and just use it on something else. I mean, I understand the plight and everything, but what this would do to sponsors is, the condition would get worse and get more expensive when you're trying to remedy it. And all of this is just very stressful for the people who pay for private healthcare, predominantly in Zimbabwe. So we wanted to simplify that process for them, bring transparency to the value chain by adding, ratings for our providers and also having them communicate directly with sponsors by providing information that doesn't compromise the doctor-patient confidentiality social contract. And then, it took off phenomenally. We've been growing revenue by 80% month over month, so that's almost doubling revenue every single month. And we're about to launch in Nigeria and Ghana, so we're using Zimbabwe as a beachhead market. And due to the uptake and I would say the success of this product, I mean, we are opening a surgery now, so that should bear some level of testament to how successful it's been. We're about to launch in other countries in Africa.
Okay, so Healthpass is the scheme that you joined to, and it's got various options. Please walk me through those.
So our packages start from, plans. Our plans start from $9.99 per month and go all the way up to $99.99 per month. And they include, of course, virtual consultations. They also include in-person consultations for both nurses, dentists, and GPs. They also include free prescription delivery across the entire spectrum of plans. And for our higher tier plans, they also include home visits, and they also include a concierge service which would take patients to and from their consultations or procedures. This is all included in the plans. And we also guarantee for everyone porting their prescriptions over to us that they will pay up to less than 50% on what they were currently paying for prescriptions. So what we're doing on the ground is we're negotiating rates with providers, with pharmacies, so our consultations are cheaper. You're paying less than you would pay if you had medical aid and had to pay a shortfall as a once-off fee. Our prescriptions are much, much less because we work directly with suppliers. So if you are sending money home for care, it's a no-brainer to do it through us because you will save money and also have a very clear picture of where your money is going when it's spent on care and drugs.
Okay, I'm rather slow, so I'd like to make sure I get this. Yeah. So I pay, I join a plan, and then I have access to a doctor. So when I access, do I need to then pay anything else, or I'm just...
Absolutely nothing.
Oh.
Yeah.
So I'm part of a plan, so it gives me access to
a fixed number of consultations and prescription spend per year, and we don't have any waiting periods. So oftentimes when someone joins a plan within the same day, we've had them have a full physical. We also supply health monitoring devices to people who have diabetes and hypertension to monitor their health, because we're really focused on outcomes. So we're not just in the healthcare business for the business part. As mentioned before, with our credentials, we started Sila Health with the goal to increase access to healthcare. So we are, for all intents and purposes, a social enterprise. And the problem that we're solving now for African immigrants is one that increases outcomes for patients, gives a level of assurance to the people who pay for private care, and also allows doctors to be paid fairly for their services.
So where were you all these years?
I was traveling the world.
Okay, so this is the Healthpass facility, and it's a very interesting plan for me. I'm already thinking about, you've already given access to diaspora people to pay directly, because you mentioned something very pertinent, that somebody will be sick and then they go get paracetamol and they treat the symptoms instead of going straight to the root of the issue, and then it sprouts again. And especially if you've got aging parents and all these relatives back home, it's a very timely facility, given that as well. So, Mr. Nyoni, Babusi, besides Healthpass and Sila Health, what other initiatives have you been undertaking?
So, Sila Health actually started as an experiment by an agency I run that's called Triple Black Agency, that's out of Amsterdam. And the goal of this agency is to create what we call interventions with a focus on the sub-Saharan African region, using emerging technology. So we typically work with machine learning, either through computer vision or natural language processing or time series prediction, to, as part of our experiments. For example, we've created a web app that can rate the Vosho dance move. This was something we did, I think, in 2019. When was the Vosho hot? 2019?
18, 19, somewhere there. Wasn't my cup of tea.
And for us younger folks, we, of course, really loved the Vosho, and the web app wasn't something that required an app installation and used computer vision to tell you how good your Vosho was. And we took our learnings from creating this Vosho dance app, and we built an app that helps in the diagnosis of Parkinson's disease through measuring time, movement, as we were doing with the Vosho dance move. So we were also able to take that, that dip calculation to understanding someone's gait and posture as they walk over time, and seeing how that changes, and helping healthcare providers accurately measure the change in someone's posture. And this was something that we presented at Oxford University and at a Google Tech conference in Silicon Valley, and also across Kenya as part of an initiative by the Ministry of ICT. And we also created the first machine learning model that can accurately classify Black women's hairstyles, the first one ever, which is important for those who are in STEM and ICT, because a lot of these technologies that use emerging platforms like machine learning are built basically for people in the global north. By global north, I mean people in Europe, people in North America, and oftentimes when Black people have to use these platforms, they have to, it's almost like using hand-me-down things. It's not really made for you, and you're trying to make it fit for your purpose. And oftentimes people have to search, for example, on Pinterest, like hairstyles for Black women, because if you search hairstyles, you're just going to get,
Okay. Wow.
Yeah. So we, I think an interesting thing to note is that the Parkinson's diagnosis app was built in collaboration with Ndlovu from Site, and also I just forgot the name now. It's a geriatric nursing home here.
Ekphumeleni.
Yes, Ekphumeleni, exactly. So we worked in tandem with them. We did our research directly on site, and it was something that was a world first, that literally came from Bulawayo, from Ekphumeleni geriatric nursing home, and eventually went to take on the world.
Out of interest, what is the name of that app? Because Parkinson's and all these diseases, degenerative diseases, we don't have much information on them. So if anybody's interested, the name of the app and yeah.
So the app is called Patana AI. Patana is a village in Gwanda where my late granddad lived, and he presented all the symptoms of Parkinson's disease. But I think, culturally, we would just take that up as something that comes with old age. Of course, your posture will change. Of course, you're going to start, having hand tremors and everything. And so I named it after him because I'm pretty convinced that his case went undiagnosed. And I think there's so many undiagnosed cases of Parkinson's in Africa.
Absolutely. So what can we look forward to from you and your team?
So Sila Health is currently in the middle of raising its first round. We're looking forward to increasing our footprint on the African continent. I wrapped up a meeting this morning with the health department of the city of Bulawayo. We're working on some stuff around vaccine hesitancy and looking at how we can harness machine learning to change people's perceptions around vaccinations, and also understand sentiment around vaccines as well, and do the bit that we can with the technology we've built in order to uplift the communities we're from. And I would say that's going to be pretty much it, because that's been a common thread throughout our operations, throughout my career. It'll always be, interventions for people, by the people, for the people, and whatever form that takes in the coming years, believe it'll be that.
So for a young person watching you right now and wanting to go into this field of AI, is Zimbabwe supportive of such creativity, or do they have to leave the country? I know you left the country quite a while back and you've been South Africa, now you're in Netherlands. Is this environment conducive, or should they just look for a visa, passport, go?
So, I would look at it in two ways. So there's a study, or what is it called? It's an index. It's called the AI Readiness Index, that looks at countries' capabilities to implement AI, I think in policies, and also, of course, in actual on-the-ground implementations. And Africa lags behind the rest of the world. So it wouldn't fall squarely on Zimbabwe's shoulders to be, behind on this. But there's an interesting thing with the advancement of AI right now, in that there's this guy called Kai-Fu Lee, who was the head of Google in Asia. And he has this really brilliant article where he talks about the age of implementation, which is basically a look at the state of machine learning right now, and how, according to him, and this is also based on evidence on the ground, machine learning at this point is no longer dependent on the research and time spent in the lab to try and figure things out and build new technologies, which is what I would say North America was, pretty good at. Where machine learning is now is in what he calls the age of implementation, where now there's a need for practical uses, like use cases of machine learning technologies, that as an African who still very much has a Zimbabwean passport, I come, automatically imbued with this ability to solve problems, because we are constantly solving problems just by the extension of living, on this continent. So I think there's a massive opportunity for Africa's youth, and maybe even specifically Zimbabwean youth, to find their role in this machine learning AI growth story, because the technology has been built. There's so many use cases for example, computer vision. You can easily identify spoiled fruits, or fruit that might be diseased or something, autonomously at scale, and the barriers to entry now in terms of hardware and software are very low. So there's so many things that can be done. I think it's honestly ours for the taking, or will just be elapsed once again in this fourth industrial revolution by Asia, that is doing so much work in finding use cases for machine learning, especially in China and in Indonesia, where ethically people don't mind seeing something that works in another region and seeing how they can refactor it to their own. And I think there's so much that we can do, given how the playing field has been somewhat leveled now, and given our high literacy rates. I only have a high school certificate, so I can speak with confidence to say that you don't need to invest as extensively in education now to make an impact in the workforce.
Okay, so the geographical location, given the nature of the work, does not stop you from pursuing it and pursuing it well.
Yeah. Of course, there will be some barriers like access to the internet and the costs associated with that. But I think these are things that, as an innovator, one can work around. So I wouldn't limit myself on the basis of those conditions. But yeah, there's so much that can be done that is being done right now.
Fantastic. So as a roundup to Sila Health and Healthpass, how can people find out more information and sign up?
So we will be sharing a link in the comment section where you can see Healthpass and see all the benefits I mentioned, which I know sound too good to be true, but we have so many happy customers and subscribers and patients and doctors as well that can surely attest to why this is such a necessary thing. And for those who might not want to type and just want to hear me say the URL, it's www.sila.health/healthpass. And for those who'd like to contact me, my Twitter DMs are always open. It's at Babusi Nyoni, that's my first name, last name. And my website is myfirstnamelastname.com. And you can find Triple Black Agency at www.triple.black.
Okay. Babusi, thank you so much for a very eye-opening, very interesting discussion, especially this health issue, because we find that so many of our people here in Zimbabwe are not on medical aid, don't have access, and just think of government hospitals and the queues. It's a nightmare, and COVID just seemed to basically kill our health services, given that the influx of people and our resources. It really took its toll on the health sector. So I'm very excited to hear about this innovation, and we wish you all the best, and we look forward to hearing more from you, even across the seas when you're back home.
No, thank you so much for having me.
It's a pleasure. I was chatting to Mr. Babusi Nyoni, and he is the CEO of Sila Health. And we are going to put the details of how you can find out more about this innovation, this health innovation. It's a health plan where somebody can pay from overseas, and you join a plan where you can get access to doctors virtually and in person and get things like your prescriptions delivered straight to your doorstep. And I think that is a huge milestone for the health sector and health rights in Zimbabwe. My name is Sizwakele Ndlovu. Thank you so much for watching The Breakfast Club on Asake Online, and it's bye for now.